Aging, obesity and diabetes are linked by some common outcomes, although you can think of that as saying that obesity and diabetes exacerbate and increase the risk of adverse outcomes which you see with aging. Common examples would be dementia, which we know is increased with obesity and markedly with diabetes, damage to the centre of the back of the eye, maculopathy, markedly increased in diabetes, such as in the end, the major problem in type 2 diabetes is maculopathy rather than classic retinopathy. Heart disease, of course, is biggest risk factor is old age, but it's tripled if you have diabetes, and it's increased if you have obesity. So what might be the link between these things metabolically? Well, one of them is simply calorie excess and calorie restriction. In aging, of course, there are a huge range of calorie restriction studies from everything from nematode worms up to non-rhesus monkeys. Also some surrogate studies in man showing that calorie restriction improves your absolute health, your longevity in those animals, and the same surrogate markers in man. Then there are a series of metabolic pathways relating to protein synthesis, to inflammation, to energy metabolism, to the way we handle things like oxidative stress. Where do these common pathogenic pathways come from? Well, they come from very simple organisms. We begin with bacteria. If you think of a bacteria, it exists in an environment where it needs substrates, nutrition, say from some form of carbohydrate. But remember, carbohydrates are also toxic. In excess quantities, they're poisonous. Why are they poisonous? Well, they're fuels. I mean, my brain is running on glucose at the moment, but we know excess glucose, as in diabetes, is toxic in the long term.